Namaskar. Welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring you experts from Apollo hospitals to the live show. You got some questions and queries? Join us. YouTube chat is where you can type your question, and I'm going to place this question before our expert and get you an answer. On the show, we do have a health quiz. Participate. 3 simple questions I'm going to ask you, and you can win prizes from Apollo 24/7. Apollo 24/7, an app that can bring you the entire facilities of Apollo Hospital to one app. You can book lab tests, diagnostics, all medicines, and as well as consults. We are giving away coupons on this show. Towards the end of the show, you can find the coupons that I'm going to give away. So stay with us and get ready with your questions. आज हम बात करने वाले हैं मॉनसून के बारे में. बारिशों का महीना शुरू हो गया है. So we're going to talk about rainy season, the monsoon defense, everything about how do you maintain your respiratory health, clear lungs, healthy skin, the vector-borne diseases like mosquitoes, se kaise bache, all of that. Today we are having a specialist from Apollo Hospital, Dr. S. Jayaraman, who's a pulmonologist from the Apollo First Med Hospitals, PH Road, Chennai, with more than 25 years of experience. Dr. Saab can be consulted for asthma, respiratory tract infections, lung abscesses, bronchitis and other pneumonia treatments. And he's been a professional member of Indian Chest Society, Indian Medical Association, Indian Association of Bronchology and Internal Pulmonology. And he's published various papers as well in international journals and 8 papers in national journals as well. So let's welcome Dr. S. Jayaraman. Good morning, sir. Welcome to the show.
Very good morning. Namaste to everyone. Greetings. Thank you very much. Nice.
Thank you, sir. Sir, the rains have started. They have started delayed in certain parts, but they have lashed really badly. So we see waterlogging, we see people struggling. Now day-to-day life also has been affecting across the country. We've seen severe heat waves. While people were recovering from heat waves, now the monsoon is grappling our daily life. So other than being stuck in the monsoons, vehicles being stuck, not able to get out, do seasons have repercussions on our health?
Yeah. Seasons, usually the monsoon changes. It brings lot of diseases, mainly the infectious disease. So usually in our part of the world, mainly the North India, mainly the Tamil Nadu, Kerala, Andhra Pradesh, Telangana and Karnataka, this is a northeast monsoon another next month. So August, September, October, we are going to face. During the monsoon changes, lot of infections, mainly the virus. Because these climatic changes, this cool climate, rain season, the virus replicate enormously. Because this is one of the seasonal changes. The virus and all multiply, and lot of numbers. It causes plenty of the respiratory diseases. Respiratory viral infections are very common during monsoon changes.
Right.
And also because of rain, because the water stagnation in front of the house and the grounds, the lot of mosquito breeding, which causes the lot of protozoa and mosquito-borne diseases, vector-borne diseases, and because of the water contamination, which leads to a lot of gastrointestinal diseases. So during the monsoon seasons, a lot of infections, mainly the virus, bacteria, and the protozoa and fungus, all because of the respiratory. It affects the respiratory system predominantly, and the skin, gastrointestinal, and a lot more. So monsoon changes one of the notorious season. So we have to take care of our health. Very, very important. Yes, sir.
Yes, sir. So while you say that we have to take care, is there any kind of preparation? Just say defense, our topic for the day is called defense. So do I need to prepare myself rather than, it's come, it is on me and I take care of it. So how do I prepare? Is there a role of immunity, exercise, diet, sleep, etc.?
Yeah. During monsoon seasons, a lot of viral infections. As a respiratory specialist, we see a lot of viral infections of the lung, mainly due to the influenza virus, flu infections. So we call it as a swine flu, are very, very common during monsoon changes. To prevent that, we have effective preventive vaccinations for flu. All the risky group in the sense 50 plus all individuals, and less than 50 plus 50 years age group peoples, those who are having comorbid conditions like any chronic diseases like diabetes alcoholism, smoking individuals, chronic lung disease, asthma, TB, COPD, heart disease, kidney disease. They are all vulnerable people, including pregnant. Pregnant ladies are prone to get a lot of flu infection. To prevent this kind of a flu infections, so we have to take care of ourselves by taking vaccinations. Plays a major role. Apart from the hand hygiene and avoidance of entering, going into that rainy areas outside. This is all the preventive, primordial prevention. Vaccinations plays a major role. This is a protective weapon against these kind of infections as a respiratory perspective. Apart from the flu infections, we have a lot of other infections, mainly the other virus, respiratory
Ah.
syncytial virus, adenovirus, and some bacteria will cause diseases of the respiratory system, which causes bronchitis, allergic sinusitis, infections, and pneumonia also. Sometimes these infections can lead to fatal, mainly the risky group like uncontrolled diabetes individuals, uncontrolled heart disease, asthma individuals, which leads to a lot of infection. So respiratory virus are very important thing. We have to prevent effectively by vaccination and avoidance to going into the field of rainy areas and polluted areas. So we have to safeguard ourselves to prevent these type of catastrophe of our health. Yes.
So while you were saying that vaccination is important for these groups, also you have mentioned that hand hygiene, or avoiding certain contamination or avoiding certain places is important. So before we get into deeper knowledge of vaccination, quick hand hygiene importance, please, and how we can do masks help here.
Yeah. Hygiene, there is a discipline. Hygiene in the sense a lot of health hygiene, sleep hygiene, respiratory hygiene, and hand hygiene. Hand hygiene is very, very important. During the COVID time, we learned a lot of things. Even you touch the table, objects, anything, you keep in the nose or in the eye areas, the infections, the virus spread into the through the nose and eyes to the system. So hands are very, very important transmitting factors from the objects and other things and all. So hand hygiene, soap and water or simple water washing of hands every time, minimum 5 to 10 times, or any object you are handling. So the hand washing is very, very important because the hand to foot diseases, hand to nose diseases, it causes a lot of gastrointestinal vomiting, diarrhea, and other major diseases, and infection also through nasal route. If you touch any objects containing viruses, if you touch the nose or the eyes, it goes into the respiratory system, which causes the bronchitis, pneumonia, a lot of infection spread, which may lead to once the infection get in one person, it will affect the entire family. So children and the aging, extreme side age group people are more vulnerable to catch this kind of infection. They are more sufferers, so more mobility and sometimes mortality also. So to
Yes, sir.
prevent that, mainly hand hygiene are very, very important. Yes.
Correct. So here are two questions that our audience have already asked. So, any role of collagen and vitamin C or as supplements to improve health in monsoon?
Yeah, the collagen and the vitamins are very important adjunctive treatment. This is not a main treatment course of treatment. This is adjunctive treatment in the sense supplement. So we have to take vitamin C and other collagens and good food, good nutritious mixed diet in the normal diet. So healthy diet means we usually, we advise the patient to take the vegetables and greens and fruits. These contains lot of vitamins and collagens. It will improve the health day by day, and there are a lot of nuts and proteins, mainly the dal and other things are very important to increase the immunity. Thereby, we can prevent these kind of infections. So thereby, we can prevent unnecessary morbidity, the sense suffering rate and the mortality. There is a death rate and all. So the vitamin C and collagen, other vitamins plays a major role in preventing and improving our immunity. There is no doubt at all. Yes.
Wonderful, sir. So here's the next question that I wanted to ask you, sir. This is, I get female hair, 30-year-old. I get nose blocks and heavy sneezing every rainy season. How can I manage it overall?
Yeah, this is very classical. Every seasonal seasons, some of the fish, some of them they affect by the viruses which causes the running nose, sneezing, itchy nose, and the itchy throat, which leads to bronchitis, sinusitis, rhinitis, and headache. A lot of problem will come. So this we call it as the seasonal And seasonal, mainly the rhinitis, rhinitis or bronchitis and all, because of the viral infections. Every seasons, you take the seasonal variations, a lot of infections, mainly the viruses, respiratory syncytial viruses, adenoviruses, paramyxoviruses, and influenza viruses, which causes these kind of illnesses during the monsoon changes. This is a seasonal thing. Some of them they have a perennial. Perennial means throughout all the season, whether winter or summer or autumn season, all the season they have. Some of them they develop only the seasonal variations, mainly the
Correct.
October, November, December. They have a lot of running nose, sneezing. So these kind of patients, we have to take the preventive measures like vaccinations and intranasal corticosteroid nose spray, nasal spray, and sometimes the anti-allergic tablet, sometimes the anti-flu medications help in controlling the disease and preventing other complications. Yes, ma'am.
Very well answered, sir. Actually, right. So keep an eye on what your symptoms are, and are they appearing seasonally, and what is helping you. Keeping a record of what you have taken and how you are behaving or responding to it is also helpful if it is a clearly recurring kind of disease. Wonderful, sir. So next question, we are going to talk about vaccine. Here, Santa Lakshmi and the registered user, both of them are asking, how can I prevent influenza, and what age can we take vaccine? Is it for any age and every age?
Yeah. Regarding vaccinations, vaccine is a biological substances. There are live form as well as the dead form. Nowadays, we are using all the dead form to prevent side effect of the vaccinations. So vaccines are one of the primordial prevention of any illnesses, including cancer, infections, lot of things. So coming to the respiratory vaccines, mainly the flu vaccine. Influenza is a very common during the monsoon changes, mainly the northeast monsoon, mainly in our North India, October, November, December, or in if you are in the Arabian Sea areas, this August, September, October. So these kind of seasonal variations, lot of influenza, A viruses, and other viral infections are very common during these monsoon changes. So we have to prevent ourselves by taking the influenza A vaccinations. Flu vaccine is available throughout the world. In our place, also available very frequently. These vaccines indications are very clear that before monsoon, the risky people, mainly the 50 plus all people, less than 50 age group people, those who are having a chronic conditions like any diabetes, underlying poor immune systems like any asthmatic individuals or TB affected patients, or because of the smoking lung disease like COPD patients, or the patient is taking any malignancy, cancer treatment, or rheumatological treatment patients, and pregnant ladies. And also, this vaccine is indicated in all the age groups. So, 2 years, from the 2 years of age group to be administered annually before monsoon. This is a flu vaccinations universally available in all the places to prevent a flu pneumonia. We call it as a swine flu. Mainly the September, October, November. We usually give it to all the risky people, frequent travelers, and healthcare peoples like doctors, paramedics, nurses, everyone, and the older people, extremes of age group peoples, those who are having a chronic lung disease, chronic diseases. So these kind of vaccines are very, very safe. There is no major side effect at all, except a minimal side effect in the form of some kind of 1 in 1,000 people may develop little fever and mild pain swelling. That's it. There is no major complications, no major adverse effect from these kind of killed vaccines. This is a very, very important recommendation from the World Health Organization as well as the CDC Atlanta. There is a Center for Disease Control
Yes.
Atlanta. Clearly, take the vaccination. This is a very important prevention for the flu infections. Yes.
Yes, sir. So, one more question is, this is an annual vaccine, not like the other vaccines where you have taken one shot and you're protected for life. Ye har saal, you have to go and get your vaccination done. Why is it so? And if I've taken a few shot last year, can I relax for this year?
Correct. There are flu vaccine. There are 3, 4 strains every year it will change because of the mutation change and drift and shift of the microorganisms in the viral replications. So every season it will be different. Sometimes we catch H1N1, we call it as a swine flu. Sometimes H1N2, sometimes H2N2. There are 4 common strain pattern occurring every year, every season. It will change accordingly. Every season there's a different kind of season. So last year H1N1, this year, same H1N1 or H2N3, different kind of strain pattern we are seeing in the virus morphology. So scientists usually advise to 1 month or just before the monsoon, they find that what kind of strain of viruses is spreading in the world. So they recommend to our healthcare team to give this kind of vaccinations, whether it's southern vaccine or northern vaccine, hemisphere vaccine, they advocate. So every year the vaccine pattern will change. So to correctly match the infections, so we need to tackle accordingly. So these kind of vaccine to be repeated every year because of the shift and drift of the virus morphology. Yes.
Yes, right. So important that we need to get yourself vaccinated every year depending on the strain. So, which is the best time to get the vaccination done, sir?
Yeah, in our part, mainly the South India, mainly the Tamil Nadu, Kerala, Karnataka, Andhra Pradesh, and Telangana. Usually, we are going to take vaccination before monsoon in the month of September. So, September, October is the ideal month to take the influenza A vaccinations. So, during this September, October only, we get a lot of rains. Mainly, we call it as northeast monsoon. Northeast monsoon. So, one of the main culprit, the lot of virus replicate. This is a very good season for the viruses replicate and spread each and everybody. The risky people, catches this kind of infection and worsen. Lot of worsening of diseases, which leads to hospitalization. So the best ideal time to give the flu vaccination annually is the in our place is the September October, mainly the August
And how
September
about
October.
North
September,
India, sir? And
yeah,
how
this
about
is the
North
intra.
India?
Yeah, northern part mainly they have April, May, June. They have a lot of rain season in Mumbai, other areas. They develop the northern hemisphere vaccinations. So these kind of vaccines they differ slightly the northern and southern hemisphere vaccinations. So accordingly, as per our Indian Council of Medical Research and WHO, ICMR, they will release the guidelines. So then and there, so we have to follow strictly. As per the South India is concerned, we Tamil Nadu, Hyderabad people, we used to take the vaccinations in the month of September. September is the ideal to time to take the flu vaccinations annually. Yes.
Right, sir. So, this is an important understanding of vaccines depending on which area that you are living. So, that is also playing a major role on when you get your vaccination. And every year, make sure that you and your loved ones are getting vaccinated, which is very, very important. Right. So that's a very comprehensive information about vaccinations, Dr. Jayaraman, sir. Now, I'm moving on to the next question. In case that somebody else has other vaccination related questions, please shoot them. We shall take it as we go forward. So here's the next question. Aishwarya is 24-year-old. Sir, I love being out in the rain. So what are the precautions that I should take? So it's not just the health. It's not just, 24-year-old wants to go out in the rain. And children also, sometimes they would want to go get wet. Other than the respiratory illnesses, what else should we take care of?
Yeah. So during the rain season, mainly we are facing in our places is the waterlogging. Waterlogging in our areas, in the mosquito, in the balcony areas or in the terrace. A lot of waste materials. If the water stagnation, this is the clear water, rainwater stagnation, which leads to the mosquitoes. Mosquitoes is one of the important enemies we are facing nowadays because of the mosquito bite. Mosquito-borne diseases, it comes under the vector-borne. It causes a lot of protozoal infections like malaria, dengue, lot of viral
Dengue.
fevers. So yeah, dengue fever is one of the important fever. Chikungunya and the malaria is very common. Chikungunya and the other virus. So these are all the diseases mainly due to the vector-borne, mainly the mosquitoes. Mosquitoes. So mosquito breeding places. So the Anopheles mosquitoes and other Aedes aegypti mosquitoes. So nicely grown in the clear water, rainwater in the terrace or the balcony or in the lot of plantations in the pot and other things and all. So we have to make sure our house in front of the house, in front of the gate and the balcony areas and the terrace, we must keep clean. I watch so everything is cleaned down. Any stagnation of water more than 24 hours, the mosquito, it will cause a lot of breeding, which leads to a lot of infections like malarias and dengue fevers and a lot of mosquito-borne diseases like chikungunya and all. So these kind of thing we have to avoid. So water stagnation and these kind of thing we must take care of effectively. So if you have no diseases, just in the rain, you want to enjoy the rain, you can see and other things and all. So any diseases already you're suffering from, you have asthma or any pneumonia, any kind of diseases. So better you avoid going into the rainy areas and water contamination. Because of the water contaminations, a lot of GI, gastrointestinal diseases, skin diseases, a lot of system affected by the vector-borne, mainly the mosquito breeding diseases and all. Yes.
Right, sir. So while you're saying that yes, vector-borne diseases, that is mosquito-borne diseases, are major. We'll come back to it because Bengaluru, Delhi, and other places, especially the northeast, like after Brahmaputra flooding, there are so many diseases which are spreading rampantly. I'll come back to you shortly on those and those managements, sir. But right now, also you have mentioned skin issues. I go out into the rain, there is drain outside, there's so we don't even know where the water is contaminated, and fungal infections are on the rise. There was somebody who was asking that every rainy season that their toenails and the fungal infection on the foot increases. So what are the chances of these spreading to one another?
Yeah, any wet skin or wet areas in our body, the fungal no infections they grow. Mainly the immunosuppressed individuals, diabetic individuals, or any long-term medications individuals. If we have to keep the healthy skin, for that the excessive moisture and very less moisture also we will take care. So adequate moisturization of skin is very important. So we have to take care of our skin by taking plenty of water. Hydration to ourselves is very important, and unnecessary any scratch or skin lesions we have to avoid by contaminations through this kind of waterborne water entering into the skin areas and causes a lot of fungus, fungal infections, one of the chronic diseases of the skin. So commonly we see in our area, skin infections are very common because of the excessive moisture in the skin, which affects the fungal diseases, which causes a lot of secondary infections in bacterial and other infections. So we must take care of our skin is a very important thing because skin is one of the largest organ in the body. Through the skin, a lot of infections is going in, and we have to take care of our skin by wearing a proper cloth and proper hydration. All important. Yes, ma'am.
Very rightly said, sir. And also, diseases spread really fast from one person to another. Contagious diseases in the monsoon season are really rampant and rapid. We need to be on our alert and safeguard all the time. Here's the next question, sir. How do we understand if it is a normal fever or a viral fever?
Yeah. See, mostly in the case of monsoon changes, we get a common cold. Common cold because of sometimes we get the allergic inflammation or infectious inflammation. If it is a common cold, it will be there for very minimal light temperature, low grade temperature and body pain. Within 2 days, it will go. But in the case of viral fever, you get a high temperature of 101, 102, and body pain, throat pain, headache, so tiredness, fatigue. These are all the viral fever. Mostly viral fever means high temperature, 102, 103, body pain, throat pain. This is all the classical. If it's a simple, common cold, little mild fever, running nose, sore throat, very little, 2 3 days it will be over. But in the case of viral fever, flu fever, influenza, and other viral etiology fever, it may run in a very long time with a high fever, fatigue. It causes a lot of issues in the health system. So we differentiate whether it's a simple cold, more than 2 days fever, body pain, tiredness. So we have to rule out a virus fever. We have to find out what kind of viruses, whether it is a flu virus or any other viruses, needs any specific treatment or non-specific symptomatic treatment. So we have to assess this way. Yes, ma'am.
Right, sir. Here's the next question. Mr. David is asking, sir, as you said, hand wash is important. If it is not available, can sanitizer be used?
Yeah, so we can use the sanitizer. The best hand hygiene technique is the simple tap water. So water cleaning of hands is very useful, essential. If you have a facility of any sanitary solutions or soap, this will be a better bactericidal and virucidal soaps are available. So we can use that. So start with the simple water cleaning with the hands are very important. If you have facility of any hand rub or other chemical, Dettol, other things, you can use that. There is no harm in that. It will be very additional add-on to that normal hand washing. Yeah.
Right, sir. So here's the next question. Do air purifiers help in avoiding constant sneezes?
Yeah, air purifier is one of the important adjuvant instrument, also adjuvant device. So keep the room very clean, neat, and all. So apart from the proper maintained air conditioner and air cooler, the air purifier it will help in very clearing all the microbial organisms. As per the recommendations, air purifier are the one of the role to prevent the allergens, infections. So using air purifier in risky people are very, very important. We are advising all our respiratory patients, allergic patients in the room or in the main hall areas, mainly in the bedroom area during the sleeping time. So we have to use. We tell the patient to use the air purifier. Is one of the important mechanism to keep the clean air in the room. So this is a very important preventive and protective device aids in a healthcare system available now. Nowadays, we are recommending to use the air purifier. Yes.
Wonderful, sir. Thank you. Next question is from Mr. Danu, 27-year-old male. Sir, I have not noticed that I'm feeling a little more moody or dull, especially when the weather is cloudy and rainy. Is the monsoon season affecting my mental health as well?
Exactly. Yeah. During the monsoon changes, a lot of hormonal imbalances, hormonal upgradations takes place. It causes some little cloudiness of mind and moodiness. So this is a very common phenomena. And because of this hormone imbalance, a lot of people they feel lazy and other thing and all. So a lot of variations we are finding with the people during the monsoon changes. So definitely there is no bodily changes during the monsoon changes and mental changes. Everything is there we are observing. So this is some kind of a physiological thing. You need not worry about much at all. So we will take care normally. So do the routine things. This will take care of our health in a positive manner. Yes.
Right, yes. Down under the weather, you feel gloomy. It is. So keep your exercise regime on. That can also help you. So let's also talk about good sleep, hygiene in, wet clothes, and then drying out, mold and other, things growing in your house. Can we just quickly talk about those as well, sir?
Yeah, yeah. See, sleep hygiene is so very, very important. So we have to meticulously follow the sleep schedule, going to the bed correct time, waking up the correct time, and we have to avoid a heavy dinner before 2 hours of sleep, and we have to avoid coffee, tea, other things, no, just 2 3 hours before, and we do the exercise daily in the morning or evening, not just before the sleeping time, and so do some meditation techniques. This all we call it as the sleep hygiene and avoidance of gadgets, mainly the electronic gadgets in the sleep room, in the room bedroom, mainly the TV and phone, mobile, a lot of electronic gadgets to be avoided in the sleep room. Bedroom is very very important. So these kind of sleep hygiene we have to follow meticulously. And cloth also during the rain season we have to wash properly and press it with the proper
Right.
ironing is important. Otherwise, a lot of water contamination, fungal infections, it causes skin lesions, skin irritations. So these kind of skin hygiene and sleep hygiene are very important. Not only monsoon changes, so all the seasons we have to follow meticulously. During the summer season also, a lot of heat waves and other things, we have to wear the proper cotton dress and proper dressings are very, very important. Avoid excessive sun exposure and avoid excessive heat exposure, which leads to sunstroke, heat stroke, and all. So these kind of things are very important when talk about the monsoon changes in the skin areas and the sleep are very very important. Yes, ma'am.
Yes. And also, if you have left your wet clothes or the bathroom or the damp walls, all the moist and the humid walls can also increase in the growth of mold, and especially somebody
Yeah.
who's allergic to it. What are the problems that can arise out of?
Right. In the case of the fungal mold and dampened wall in that areas, you can see the white patches in the wall. So these kind of thing more commonly we are seeing in monsoon rainy seasons. So these kind of thing we exposed to that mold. Mold means usually the fungus organisms. Chronically, long
Of
term we
course.
inhale these kind of fungus mold. It causes the lung disease called the hypersensitivity pneumonitis. It's kind of allergic diseases. Hypersensitivity to the fungal mold. We have to avoid that kind of thing. Otherwise, patient may lead on to the asthma-like diseases. But this is not asthma. Asthma-like because of the fungal mold exposure, which leads to chronic infections of the lung, so chronic cough and cold and sneezing and wheezing. It mimics the infection sometimes, it mimics the allergy or asthma sometimes. So we take care of the wall are very important. So during the monsoon changes, we have to take care of our surroundings are very very important. So environmental
Yes.
health is very important. Wherever you stay, in the bedroom or in the washroom, the area should be clean, neat, and wet. We take care of our this thing. Then only our environmental health, our health will improve. Yeah.
Right, sir. Right. So next question is from Mr. Raj Kashyap, who's 40-year-old male. How can I differentiate between symptoms of dengue, malaria, and chikungunya, and when to get tested?
Yeah. So most of the time we advise the patients any fever, any body pain, take at least 2 days medication with the doctor's advice. Don't purchase over the counter. Get 2 days medications like symptomatic supportive treatment like paracetamol and rest and take hot water. If it is a more than 2 days fever, so we have to check whether this is monsoon changes disease due to viral disease like malaria or chikungunya or dengue fever. The chikungunya, dengue fever, mostly the viral and these kind of infections very commonly we see. So dengue fever we call it as a breakbone fever. More than 2 days fever, high temperature, body pain, joint pain. We call it as a breakbone fever. We'll do the blood test and find out the blood counts. Very very important. If we suspect any malaria, malaria means usually fever, chills and rigor and body pain. So we will do the blood test. Any fever after 2 days or 3 days fever, we'll do the basic blood investigation to start with the complete blood count. It will give the clue what kind of infection, whether it's a bacterial or viral or malarial, like we can differentiate. So based on this, we give the treatment for that. If it's a malaria means usually fever, rigor, chills will be there. So rigor, so bodily tremor, these are the classical symptoms of the malaria. If it's a dengue fever, chikungunya, the body pain, joint pain will be very more. So any more than 3 days fever, don't purchase the medicine over the counter and get the physician opinion and start the medications appropriately to prevent complications of the ailment. Yeah.
Yes, and Apollo 24/7 is here with you whenever that you need to buy medicines or get your lab tests done, simple CBC or any other viral tests to be done, or consult a physician. It is quite simple to consult a physician, and we are leaving Dr. S. Jayaraman's link to consult on Apollo 24/7 as well. In the chat box, you can consult him for further services as well. So next question is about Santa Lakshmi is asking the question. Sir, if I'm affected by influenza B, can the person take vaccine immediately, or is there a waiting period?
Yeah, if you catch the infections, influenza infections, the vaccine will not work. So vaccine is mainly before the infection, no, entering into the body, we have to take care. So at least it will take care of 2 to 3 weeks time. So you can give the vaccine to the in your household people. Other people we can give the vaccinations. So if it is a influenza A or swine flu in one person in the family, so other person they are not no getting disease means we can prevent them by giving the vaccinations or by giving the preventive tablet also available for the swine flu. A lot of tablets is anti-flu tablet available. So as per the physician advice, we give the preventive dose daily, once daily for 10 days for the preventive aspect. For the patient already suffering from the flu means we give the anti-flu twice daily for 5 days as per the physician's prescription. So these are all things are very important because these are all the antiviral antibiotics with the doctor's prescription you must take and when to take, how long it will take, all very important. So physician clearly we advise to take this kind of anti-flu tablet, how long, preventive, etc.
Right, sir. So, Mr. IS, mom is taking Allerfix M and using for air inhaler for a severe cough as advised by doctor once daily. How long should she continue this medication? It's been 3 months. She's better now, not coughing in the night. But once inhalers are put in, so what is the kind of frequency that they have to visit and revisit their dosage?
Yeah. Usually, this kind of allergic conditions, whether allergic rhinitis or allergic asthma, most of the diseases are chronic diseases. You may require the long-term, lifelong treatment sometimes. Majority, if you confirm the asthma allergy mostly run in families. If any family history of father and mother or uncle, auntie, or any grandma, grandpa, they are having the allergic issues and asthma issues, this may run in families like a familial disease. So these kind of patients, mainly to avoid all allergens, irritants, wearing the mask and vaccinations. Apart from this, the low dose maintenance dose of the inhaled medications. Inhalers are very important prevention of any attack, asthma attack, and the worsening of any allergy conditions. So, as per the physician's advice, you must continue the inhalers and nasal spray with a long term, with a maintenance to prevent worsening of the disease. So, and periodically we do the testing to see blood test and the lung function test in the case of allergic asthma or allergic rhinitis. So the periodic checkup with the doctor is very important. And how long we take the medications and how often we will take the medications all depends upon the individual variations. So you must check appropriately with the concerned doctors. Yeah.
Right, sir. So, in continuation with the same question, here's a 21-year-old patient patient of COPD. How often should we schedule follow-up appointments during the monsoon season to monitor respiratory health?
Yeah. Known COPD patient. COPD, you all know well, chronic obstructive pulmonary disease because of the air pollution and tobacco smoke and secondhand smoke. A lot of people they may develop the chronic obstructive pulmonary disease. Once you diagnose the COPD, chronic obstructive pulmonary disease, needs a constant checkup. Depends upon the individual variation. Some patients may require a monthly once, or once in 2 months, or 3 months once. During the monsoon changes, before monsoon, definitely they will consult the pulmonologist and take the periodical annual flu injections. And they do the lung function test and chest radiography and bed investigations to find out whether the infections is there or not. X-ray chest is very important. During the X-ray radiography, we can find out any new lesions or worsening thing. For lung function, we have a PFT, spirometry test are available. This spirometry test depends upon the patient individual. We do it 6 months or 1 year interval. This is all the long-standing testing to see the patient's conditions. So any COPD patients, we have to need at least once in 3 months you must consult doctor. Before monsoon, compulsorily you must visit the doctor and check the pulmonary function testing. There is lung function test and the chest radiography and vaccinations and the adjustment of medications during the monsoon changes, inhalation dosages, whether increased dose or lesser dose or maintenance dose. So these we have to check with the pulmonologist periodically. Yes.
Right, sir. Mr. Tonangi Suraj. Sir, can I use nasal sprays? Do they work in the monsoons?
Yeah. We have if any patient is having seasonal changes, seasonal allergic rhinitis, sneezing, running nose, headache, every season, families of allergy, asthma, or allergic rhinitis. So these kind of patients during the entire 3 months of the monsoon changes, they have to use the intranasal spray, nasal spray. It will help in preventing and avoiding unnecessary throat infection, lung infection. Definitely, the usage of the nasal spray are very important, preventive protective thing to make the patient healthy and they can do all the activities. Prior to that, they must avoid all allergens, irritants are important. The nose spray are very, very important protective thing. Yes.
Right, sir. So next question is about stuffy nose again. Early mornings and when I cough, there's a lot solid and dark yellow phlegm which is coming out. I think it's because of the weather. Any tests or any advice?
Yeah, if the patient has any stuffy nose and while coughing, any yellow colored bulgum, phlegm is coming out. So 2 3 days we have to watch and observe. Symptomatically, they will take some nasal spray and oral tablet. If any persistent symptoms, we have to go for the antibiotic after the consultation with the pulmonologist. And if necessary, they have to undergo some simple basic investigations like blood test and the chest X-ray. And if the patient is having long-standing diseases, needs further testing to find out whether patient has any stuffy nose due to the sinusitis, allergic rhinitis, and all. So we have to rule out and start appropriate medications. Yeah.
Right, sir. So, Mr. Dasari David, who is 66-year-old, type 2 diabetes in control, hypertension, CAD, SP, PCI in 2017, has COPD as well, taking annual influenza since 2 years. I've taken pneumococcal first dose. Am I in the right course? I am under the supervision of Apollo doctors as well. So, how many doses
Yes.
of pneumococcal is required, sir?
Yeah. See, as per the recommendation for the COPD patient, 66-year-old, this patient is suffering from the COPD and other kind of comorbid conditions. So, as per the recommendation, minimum one dose of pneumococcal vaccination is sufficient. So, as per the WHO and CDC guidelines, there are three kinds of pneumococcal vaccination they're advising. To start with the injection, there is a conjugate vaccine. Conjugate pneumococcal vaccine to start with one dose. 6 months or 1 year later, we have to take the 23 polysaccharide vaccine. So after the 5 years, patient has to take the one booster dose. This is the three schedule. So first dose to start with conjugate pneumococcal vaccine. 6 months or 1 year later, 23 polysaccharide vaccine. After 5 years of second dose, they will take the booster dose of the 23 polysaccharide vaccine. This is the three doses scheduled for the pneumococcal pneumonia prevention as per the WHO and CDC. So this is the important. Apart from the pneumococcal 66-year-old COPD patient, so annual flu shot is very important. And other two vaccinations they are recommending for the past 2 years by WHO and other gold guidelines. That is a pertussis vaccine. Tdap. That is, we used to give the two doses of pertussis vaccine. This is one of the important no vaccination to prevent the Bacillus infections caused by the bacteria. Pertussis vaccine are very, very important. And other vaccine is the virus, that is a herpes vaccine. Singles, we call it singles vaccine. These vaccines are recommended, recommendation to the COPD patients. There are four vaccines they have to take: pneumococcal, influenza, pertussis, and the singles or herpes vaccine, as per the recommendation, are very important for the COPD patient. Yes.
Right, sir. So, and also people like Mr. David who are coming into the senior bracket, 65-year-old plus,
Yes.
and have diabetes or hypertension with certain respiratory issues, which actually are growing along with them. Because I've seen my parents also, these are not something that you go back to normalcy. These are just maintenance. So I understand the importance of the frequency of connecting with your doctors, maintaining your health. This is not a one time thing, and how
Yeah.
important it is to keep your records.
Correct. These kind of 65-year-old senior citizens with this kind of comorbid disease like diabetes and COPD and heart ailment, they have to check with the consultants appropriately, cardiologist and the pulmonologist and dental physician and diabetologist periodically, and they have to keep under control all the blood sugar level, lung functions. They have to keep taking medications correctly and regularly. Needs a proper checkup, and vaccinations are very, very important, and diet and sleep are very important, and the exercise program, daily walking, brisk walking, this kind of program for senior citizens, not only senior citizens, diet exercise for everybody, sleep also everybody. So these all
Yes.
things are pillars of health you have to maintain. Diet, exercise and sleep are very important pillars and foundation. We have to take care of each and every individual, not only patients. Each and every individual they have to take adequate balanced diet and exercise program, and 8 hours sleep for the adult are very important. Yes.
Yes, sir. So, Mr. David is asking, did you mention, is it shingles, sir? Yeah, I think yes, you mentioned shingles vaccine for him. You
Yes,
suggested
yes,
vaccine.
yeah, yeah. 66 people, year old COPD patient, they should receive the herpes vaccinations, herpes zoster vaccination. So two doses, 3 months or 6 months apart, as per the recommendation, is available in all the places. All the places. We go to any adult vaccination clinic or adult vaccination center in Apollo or any other center. These vaccinations are available under the Department of the Pulmonology, Infectious Disease, and the General Medicine Department. They used to give administration. These all comes under the adult vaccinations. Yes.
Wonderful, sir. Yes, all now that the new protocol calls for all the seniors to be vaccinated with shingles because it can protect from herpes zoster, please go ahead and get your vaccination done. So, Biswajit is asking a very, very important question. Sir, I do not smoke, but I am diagnosed with tuberculosis. How is this even possible? I do not understand. Can you please explain? And the complications and how do we protect others?
Yeah, tuberculosis is a very common disease in our country. When you compare to the Western world, in Asia and Africa, so very, very common infections due to bacteria called the acid fast bacteria, Mycobacterium TB is very, very common. So the lot of risky factors, mainly the immunosuppressed conditions like diabetes or other conditions, and the smoking individuals, alcoholism. There are a lot of risk factor. If you have any risk factor, you may catch the TB infections commonly quickly. If you don't have any infections, so this is the common respiratory disease we come across in our practice. This is the airborne disease. So we are traveling in the bus or car or we're meeting so many people. So they have TB diseases during a coughing or sneezing, or talking also. It may spread one person to other person through the airborne, through the aerosol spread. So you catch infections. Once you lose the immunity or reduce the immunity, you may develop the tuberculosis. Mainly 80% of the TB occurs in the lungs and 20% occurs in the outside the lung or bone or kidney or eye or lymph glands and all. So TB is very common, rampant in our India is one of the epidemic country. Lot of TB infections. If you see 10 patients, 10 normal individuals, if you do the testing, so 5, 6 patients they have infection. Disease is different from infection. So infection means they have a harboring in the microorganisms. Disease means they develop the symptoms. This is called as a diseases. So TB infections are very common. Anybody can develop the TB infections. Mainly due to the immune reduction is one of the important factor. Even if you don't smoke or alcohol, you maintain a good health. Sometimes the household or working environment or traveling people, they may sneeze and cough, you may get the airborne diseases. So TB is coming like this only. This is a common airborne spread and inhalation of this TB bacteria, which leads to infections in the lung, predominantly 80%. It may cause a fever, tiredness, loss of weight, appetite. So this is very common in our places. India is an epidemic country of tuberculosis. Yeah.
Right, sir. So there, TB अगर infectious है, if you are going through a disease of TB, then there are multi-drug therapy that we can talk about later. But Vishwajit is asking another question in related to his TB. Can I stay in the same room with my family because I am having tuberculosis? 35-year-old, kindly suggest how to safeguard the family members.
Yeah, TB is one of the communicable disease. It spread from one person to other person in the neighborhood, in the room, other things and all. Not throughout the period. If you start the TB medications, it will take minimum of 3 weeks to 4 weeks time to convert positivity to negativity. So the initial period, you stay in the preferably in the isolation room. Whenever you cough, sneeze, you must close your mouth. You have to follow the respiratory etiquette, respiratory hygiene to prevent the infection from one person to other persons. So 2 3 weeks time, isolation is good only. Home isolation is sufficient. So do not
Mask.
take the separate at all. Yeah, mask will protect the 50%. And whenever you cough, close your mouth with a hanky or mask is very, very important. Initial 2 3 weeks time, be in isolation, carefully cough and hygienically cough. This way, we can prevent infection from you to other family members. So after 3 weeks, once you take the medication continuously, the sputum, the spread rate will be reduced to almost to zero. So after 4 weeks, you need not worry about that. The cough symptoms, everything subsides. This will prevent infection spread from the one person to other person will be minimized. So initial period, be careful. Try to be in the isolation, separate room with a well ventilated room, and whenever you cough, close your mouth and take the medications appropriately as per the physician's advice. These are all things we can prevent TB infections from one person to other person. TB means completely 100% curable diseases. Needs minimum 6 months to the treatment with a meticulous monitoring every month. Blood test and the consultation with the physicians are very important.
Very, very well said, sir. One quick question, sir. Are there any vaccinations for healthy people for TB? Like, BCG is something that we heard earlier, but what is the adult vaccination status?
Coming to the TB vaccinations, immediately after birth, usually we take the PCG vaccinations. In our place, it's very, very common. So, as per the recommendations of the Pediatric Society, this comes under the Children's Immunization Program. PCG is first vaccine to be administered along with the polio drops in our country, and this is the important protection. But the PCG vaccine protection rate, mainly the severe form of disease like meningitis and the disseminated TB disease, will prevent TB meningitis and all. It won't spread the common TB infections. So any person is having the TB in the in the family or anybody members in the family, so we will take care of this patient effectively. Continuation of treatment, respiratory hygiene, good diet, high protein diet. So this way we can prevent that. So apart from BCG vaccination, there is no effective vaccination. Still, a lot of research is going on. So we'll get very soon we get the adult TB vaccine also. Yes.
Right. So it's only about, जैसे आपने पूछा है विश्वजीत जी, that it's your responsibility to take care of your family as well. So Dr. Jayaraman has advised very well. In case that you require his consultation, we will leave a link. You can consult further. So Krishna Kitur ji, बहुत दिनों के बाद आए हैं शो पर. Good morning. And what are the exercises or yoga that you recommend to increase the lung capacity?
Yeah. To improve the lung capacity, daily brisk walking is an essential thing. Apart from brisk walking, if you do the playing tennis court or badminton, anything is a good. So simple exercises to start with, brisk walking or cycling or swimming. So even singing, dancing, singing also one form of very good exercise. Singing loudly is a very good exercise for the lung, and lot of breathing exercises, pranayam. Pranayams are very important. The yogic methodology, we have to follow the breathing techniques. A lot of breathing technique, inspiratory, expiratory techniques. Pranayams are very, very helpful adjuvant treatment for improving the lung health and improves oxygenation and improves the mental capability and everything. So simple brisk walking to yoga, meditations and breathing exercises like pranayams, various kinds of pranayam, all important. So these kind of activities daily, 30 minutes to 45 minutes, it will keep you fit and it will improve your lung function, lung capacity. So to start with simple walking or the spot walking, if you don't have the place to walking or any other thing or dusty areas you are living, so simple at home exercise are very, very important. At home is a spot jogging, spot skipping and doing the pranayama, breathing exercises, yogas, asanas. This is kind of thing. A lot of asanas will improve the lung capacities. Asana, there are so many asanas are there. It will improve the lung health. Not only improve the lung health and mental health, also physical health. So these kind of pranayams and physical exercises, breathing techniques are very important to improve the lung health and overall health also.
Wonderful, sir. So next question is about emphysema. Sir, I have emphysema, and is it safe for me to go out when it is raining?
Yeah. Emphysema comes under the chronic obstructive pulmonary disease, COPD disease. Emphysema is a slowly progressive disease. So we have to be careful during the monsoon rain changes. Better you avoid going to the rain seasons or in the polluted areas or waterlogging areas. Better to avoid, or if you're going in the rain areas, you must be careful. Don't wet yourself in the rain or don't inhale any polluted air, wearing the mask, and you have to protect yourself by doing the outside activities. So you take care of yourself by wearing the proper clothes, proper dressing, proper mask. So you have to avoid that, because if you enter into the rain, if you have an emphysema means a COPD patient, they may catch viral infections easily. They may develop the worsening of disease, recurring hospitalization, requiring more medications, more nebulizations. So better avoid going to the rainy field and polluted areas during the monsoon changes, particularly rainy seasons. Take vaccination, take medications properly, take care of yourself by wearing the proper clothes and mask, all very important.
Yes, sir. So here's almost towards the end of the show, and last few questions, sir. This is by Joy, 32-year-old Joydeep Roy. So humid weather, they are from Kolkata. So the extreme weather conditions are very humid. Will air purifiers or demistifiers help? And also any recommendations on food to avoid dehydration, because we tend to sweat more?
Correct. So during the monsoon or climatic variations, so wearing proper clothes is very, very important. And air purifier at home, we can use it in the bedroom to avoid contamination of infective particles, mainly the virus and bacteria, and the irritants and the allergens are very important. And other things you must take care. The periodical vaccinations are very, very important thing. So during the monsoon changes, no, we have
So
to consult the doctor.
dehumidifier, will it help in, especially Chennai and Kolkata, Visakhapatnam, all these cities which are really humid? Will the
Yes.
dehumidifier help if somebody with the respiratory illnesses are there?
Yes, definitely. So humidifier are one of the adjuvant aid, that treatment aid we are usually prescribed in a case of sleep apnea patient. Sleep apnea patient, they usually wear the mask and sleep during night time. So we usually attach the humidifier along with the machines. It will cause us the cool air. That is to avoid the dry air causing irritations and dryness of mouth. In humidified place, we advise to use the nebulizer, air conditioners. With the proper maintained air conditioners, air coolers are very important. We advise to take the air purifier as well as the humidifier. This is one of the important adjuvant treatment for adjuvant management and maintenance for the all the healthy thing. Yes.
Right, sir. So thank you so much for answering these questions very patiently. And because the monsoon is now setting seriously, we all now have information which is power. We shall take care of our health. And before we leave, we request you to give us top tips to manage our health in the monsoon.
Yeah. During monsoon changes, we have to take care of our health by wearing the proper cloth, avoidance of entering into that rainy areas and polluted areas, and prevent infections like respiratory viral infections, mainly flu and the respiratory syncytial viruses. You must take annual flu injections and other vaccinations appropriately as per the medical consultations. And extremes of age group people, older people, they should take care. And vaccinations are very important. Along with that, water stagnation, to prevent water stagnation and clean our environment, clean our house and balcony areas and in the terrace are very, very important. You must avoid water stagnation so that we can prevent unnecessary waterborne and vector-borne diseases, hand hygiene, all the hygiene, respiratory hygiene, sleep hygiene, you must follow meticulously. So these kind of thing and the dietary thing is very important. So proper diet and mixed balanced diet along with the exercise program and daily brisk walking and adequate sleep of 8 hours in adult. So this way we can maintain the good health. And monsoon changes mainly the heat wave, heat stroke. You must wear the proper clothing. And in the rain seasons, you must take your vaccinations and this kind of thing. Proper checkup, healthy individuals. We have to help make sure that proper health checkup is very, very important. So before monsoon, you must go to the doctor and check appropriately. So this way we can prevent and manage the monsoon changes. These are the defensive mechanisms we can play easily to maintain the proper good health. So thank you, wonderful opportunity. Thank you for the good opportunity to spread across the knowledge in this kind of the monsoon changes. Thank you. God bless you.
Thank you,
Nice.
sir. Thank you, sir. Thank you so much. You were really, really very inspirational and you've addressed them with a lot of information. Thank you so much, sir.
Thanks a lot. God bless you. Nice, nice of you.
Yes.
Thank you.
Wonderful. It was a great session. We take leave from Dr. S. Jayaraman to proceed forward for the health quiz. And a lot of you who are asking about the health quiz credits, we shall forward it to the marketing team and it will be taken care. And for this week's health quiz, I'm going to give you the rules first. I'm going to ask you 3 questions. You have to answer this in the chat of the YouTube, and winners will be selected at the sole discretion of Apollo 24/7 team. If I take your name to be a winner, you have to write back with all your contact details at marketing@apollo247.com. Gift vouchers will be shared with you. Here are the 3 questions for this week. Question number 1 on your screens. Fill in the blanks. Most common diseases during monsoon are M blank L blank R blank I blank A and D blank N blank G. Oh, sorry, D blank N G blank E. So what are these? These are very simple 2 diseases that we are aiming at. Fill in the blanks to give me the diseases. The most common diseases during monsoon are, one starts with M, the second starts with E. Fill in the blanks and give me the answer. Question number 2, true or false? Vitamin C helps boost immunity against monsoon diseases. True or false? Question number 2, yes or no? The influenza vaccine helps prevent flu, bronchitis and other respiratory illnesses. Yes or no? Question number 3 is, the influenza vaccine helps prevent flu, bronchitis and other respiratory illnesses. Yes or no? Please go ahead and type your answers in the YouTube chat. Yes, I see our regulars are also answering. While we receive the answers from you, let's continue with the health coupons. Use these health coupons on Apollo 24/7. Download your app and become a circle member to get more benefits. This is the first coupon that we are giving away. Code ASKDOC150, ASKDOC150. Consult top doctors direct from Apollo hospitals. Get 150 rupees cashback on online doctor consultation. And the next one that we are giving away is FIRST 3, FIRST 3. Use this coupon on Apollo 24/7 to order medicines direct from Apollo and get 25% off on online medicine orders. Valid on the first 3 medicine orders which are above 1000 rupees. And you also get a 2-hour delivery as well when you order from Apollo 24/7. The next one is exclusively for our Health Hour viewers. Use this HH247. In addition with the other coupons, you get 199 off on online consultation with Apollo doctors and 20% off on medicine orders as well. So download the app right away and use these coupons. And next week, oh, by the way, Apollo 24/7 also can be accessed on WhatsApp. You're just a call away or text away, 9355 247 247. This is the number that you got to save to avail healthcare services from Apollo hospitals on your WhatsApp. And here are our next week's topic. Next week, it is a very, very important topic, how to manage thyroid disorders. 14th July, 11 a.m. We're going to talk everything about your thyroid, how to take your medications, what are the tests, what are the symptoms, how are you able to manage it, and everything else which is related to thyroid. Any question, please join us. You can also pre-register for the show and ask your questions in advance as well. So that is about next week's topic, and I'm seeing a lot of you are answering the questions. And let me wait if the team can pick up winners. In case that we are unable to pick up winners right now on this show, we are going to leave the winners' names in the chat box. We shall leave type the names of the winners, and winners can contact us and write back with their details at marketing@apollo247.com, and all the details of how do you write back to us with the winner's name will be left in the chat box pretty soon. So for today, I am signing off. Thank you all for joining. I am unable to type the winners or announce the winners today, but the team will announce the winners in the chat. Please do check. Thank you all. Namaskar, and we shall see you next Sunday.